We are being recorded. Throughout the meeting, if you have any questions, just please go ahead and drop those in the chat, and then we will answer our questions at the end of the meeting. So I am just thrilled to be part of this today. I love our dental assisting program. I love walking around the labs. It smells like the dentist office, and just some neat things in there that I love to look at and talk about. I think you will enjoy it too. And I'm excited to be able to introduce you to our program director, Lisa, and Lisa Brown. And she is going to be the best person here to help you learn all about this program, learn about the education, how it is delivered. So again, just any questions that you have, drop them in the chat. And we're also happy to have Katie Ort here as well, one of our instructors. So you may be hearing from both of them today. Without further ado, I'm going to turn things over to Lisa.
Thank you, Julia. It's very nice to see everyone today. I'm going to just quickly share my screen so you can see what I'm seeing. So welcome. Today we're going to be talking about the dental assisting program here at YTI. Our program overview, it runs over 4 10-week terms. So there's 4 10-week sessions that's a part of our program, and they're broken down into modules. A module is 1 10-week section of time, and you're learning specific subjects in our curriculum during that module. So you're not learning everything, the entire program. Everything's broken up into modules that are 10 weeks long. So in module 1, you'll learn an overview of dental assisting. This has a lot of anatomy, tooth counting, a lot of the different specific features of the teeth. You're also learning radiology as well as chairside procedures. Chairside procedures are anything from suctioning to placing and removing cotton rolls, amalgam, composites, sealants, things like that. We move on to module 2. Module 2 is dental sciences. That's where you'll learn all about sterilizing instruments, all about the different diseases, infection control, the different disinfectants that we use in the dental office. You also learn about dental emergencies. That's how to care for a patient that's possibly sitting in your chair or sitting in the office that might have any kind of emergency. This is also when we do CPR. We learn about allergies, heart attacks, seizures, all kinds of different things like that. Anything that you might need to care for a patient while they're in your office, we learn about. You'll also learn about dental specialties. Dental specialties are anything from orthodontics to oral surgery or extractions, endodontics, which are root canals, periodontics, which is anything involving the gums, pediatric dentists, those are dentists that specifically work with children. We will learn all about those different specialties, and we'll actually do procedures that go along with that. Module 3 starts with the administrative assistant. This is all the scheduling and online charting, different things that you can do inside of a dental software if you wanted to work at the front desk of a dental office, doing payments, insurance, things like that. We also focus on career development. This is where you will learn how to write a resume, a cover letter, interviewing skills. We do mock interviews. We talk about what's appropriate to wear to an interview, things like that, as well as laboratory procedures. That's when we learn about impressions, mixing different materials, pouring impressions, trimming them, just making all kinds of different laboratory type things. The last module is always externship. That's a 10-week term where you are actually in a dental office as a dental assistant. Your hours are counted towards that externship, and then when you complete that externship, you graduate from the program as a dental assistant. So our program delivery system is delivered through an online format without live instruction. So basically what that means is we're an asynchronous program. You have access to the course materials 24 hours a day through our LMS or our learning management software, which is called Canvas. And you'll have faculty available for assistance all along the way if you have any questions or if you need any help. Assignments are given at due dates so that you can kind of work on assignments in your own time, and you can kind of work with your own schedule and kind of work on your schoolwork when it works for you. We have students that are night learners, you know, they're moms, they have kids at home, they like to work on their schoolwork at night when their kids are sleeping, or if they're moms, they have kids that go to school and they want to work on their schoolwork during the day. This gives our students the opportunity to do that and kind of work when it suits them, as long as they're working within the time that the assignments are open. So it opens at a certain date and it's due at a certain date, but anytime within that time frame, you are welcome to work on your schoolwork. You're not required to be on your laptop in front of a live instructor at any certain time. Students are required to come to campus 2 times a week for hands-on labs. So these directly correlate with what we're learning online. Whatever concept you're learning that week online, you'll come into lab, we'll practice that concept or that procedure, we'll learn a little bit more about it, and we'll actually do that procedure. So the advantages of an online program, you have flexibility of personal and work schedules. As I said before, if you have kids at home or if you have a work schedule that you want to work around, this does give you the flexibility to do that. It's self-paced control of content learning because you're not in front of a laptop in front of an instructor doing live instruction. You can go back, you can reread things, you can work at your own pace. You also have the opportunity to learn new and future virtual central communication workplace technical skills. A lot of industries, especially the dental industry, are going online. They're going fully, you know, technology forward, and this is just kind of aligning with that as well. You can also make a personal workspace that's designed to maximize your learning style. If you like to work in the quiet, you can pick a time that's quiet and you can work when it works for you. Or if you like to kind of work around people, you can do that as well. You can pick a workspace that works for you. So different certifications that you will gain while you're in our program. During Module 1, you'll take your radiology exam. This is also, sometimes we refer to it as your RHS or your DAMB exam. This is an exam that you will take after you complete the radiology course. It is taken off-site at a testing center called Pearson VUE in Lancaster. And the cost of this exam is included in your tuition one time. Now this exam basically gives you the ability to take dental x-rays. So without this exam, you are not able to do that in an office. The second exam that you'll take is the ICE exam. This is taken during Module 2. It directly follows when we learn about dental sciences, when we're learning about sterilization of instruments and cleaning products. This is also taken off-site at Pearson VUE, and the cost of that is also included in your tuition one time. Now, the ICE exam is not required to work in an office. It's just like an extra little gold star that you can put on your resume that says that you are qualified in infection control. And in this day and age, in a post-COVID world, offices really look at that. They're looking at students that really have a full understanding of infection control and are considered proficient in infection control. So this is a great addition to your resume when you're finding a job as a dental assistant. The last certification that you'll receive is your CPR. This is also taken in Module 2 during dental emergencies. We do this on campus. Ms. Orton and I are your instructors for this course. So you will actually be healthcare basic life support certified after you take this exam. The cost of that is also included in your tuition. So when you're in lab, you're going to learn about a lot of different things. You're going to learn not just about the daily duties of a DA, of a dental assistant, but you're going to learn about dental x-rays. You're going to learn about how to assist the patients and work with the dentist chair side, the setup and tear down of the treatment rooms, all kinds of specialty procedures, the sterilization of instruments, taking a patient's vital signs, how to monitor that patient while they're sitting in the chair. You'll learn CPR. You'll learn front desk duties. So you, as a student, you would be able to go into an office and almost be cross-trained to work at the front desk or work in the back if you felt like the administrative side was more for you. Taking and pouring dental models, and also mixing dental materials. So these are all concepts that we work on in lab, and we make sure that our students are very fully aware and proficient of these things before they go out on externship. So as a graduate of the program, you will be employable at any general dentist and specialty office in the area. Offices could be a general dentist. A general dentist is a dentist that just does, you know, cleanings and basic procedures, might be just kind of your family dentist or just a general dental office. There's also pediatric dentistry, which is children's dentistry. There's oral surgery, which are extractions and implants. Endodontics, which are root canals. Orthodontics, which deals just with braces or the movement of teeth. Periodontics, which is gum surgery. Prosthodontics, which is very detailed, very high-end aesthetic dental work, as well as dental labs, making crowns, dentures, appliances, things like that. You can work in any of those offices as a graduate of our program. So at this time, I will open it up for any questions that you might have. Please feel free to either unmute yourself, or Julia, if there's any questions in the chat. If you're more comfortable putting questions in the chat, that's fine. Feel free to do so.
And I don't see any questions in the chat, but if you want to ask a question there, you can just kind of type that up. I'll read that. I will leave your name out of that. If you would prefer, that is fine. And like Lisa said, you can also just unmute to ask a question. So lots and lots of applications here for our dental assistant graduates. On Tuesdays and Wednesdays, we do offer tours of the campus. So if you haven't seen the campus, you can come in tomorrow at 10, 1, or 5, also Wednesday at 10, 1, or 5, and we can definitely walk you through the dental assisting labs. You can see the 5 fully equipped operatories in there, see the area in the front where you're going to be dealing with sterilizing instruments, and then there's a little lab in the back. You'll be able to see where you're making molds and things like that of teeth. There you'll see the x-ray equipment that's in there. So that gives you a really good idea of what your lab time would look like. And it is not too late if you would like to get started. Our next class does begin on March 21st. So if that is something that you would be considering, then you just definitely want to, let us know that, and contact someone from admissions, contact me, drop me a note in the chat. Hey, Julia, I'd like to get started on March 21st. I will help you. We can get there for you. I still don't see any questions here. If you want to look further into the program, you can go to yti.edu. I see that message that there is somebody who would like to get started on the 21st. So I'm going to just take a note there of that, and I will get in touch with you there. I'm going to drop a note in here to everyone that just says here that you can reach me.
And my apologies, Julia, I think I didn't activate something correctly, but I am getting some questions on my side.
Oh, perfect. Yeah.
So I have one question. If I leave the state line, will I be able to get a job in Maryland or any other states? So yes, absolutely. So the DAMBY, so both the radiology and the ICE, the infection control tests that you take, those are nationwide tests. So that will allow you to be able to take x-rays in Maryland. Now, there might be an additional qualification for Maryland. Every state is different, but that the test that you take here does go across for every state. As far as I know, I do believe that Maryland is a state where our students can very easily cross the line. I have some students that have done externships in Maryland. I have a lot of grads that work in Maryland. I even have some that are working for 2 offices. One office is in PA, one is in Maryland, and they don't have any issues. So as far as I know, yes, you will be able to cross the state line into Maryland. Other states other than that, you'd have to look specifically into each individual state though. Destiny, it looks like you and Julia are connecting, so that's great. I hope to see you on the 21st. That would be awesome. And I apologize, I did not have things activated correctly for you to unmute yourself and ask a question. So if you have questions and you'd like to unmute yourself, please feel free to do so now.
Awesome. And I will just put in the text here to everyone. If you are interested and would like to learn more, you can simply go to our website. Very easy to remember. Just from any browser, type in yti.edu. From there, you want to just click on the program menu, and you'll find medical and dental assistant underneath that menu that drops down. Tons of good information on the website for you. Also, a link that you can click that says get started now that can take you right to our admissions portal, which is great. It's very easy to follow, very easy to navigate, and it's going to take you right through the process. So, and someone immediately will reach out to you if you click that link. And Destiny, I've got you. I will give you a call. Any other questions?
So I have another one here, Julia. I have a question. Where will the internship take place? So that externship, we help place you in that externship if you don't have a place. We have a whole career services team that will help you with that. They'll help guide you along the way. You do get a say in where you'd like to go. When the time comes for that, you can fill out a form, even give some office suggestions that you drive by and you think, hey, it'd be cool to do my externship there. Or if you want to do it at your home dentist, the one that you grew up at, you can kind of do your externship anywhere. That's also when we take recommendations. So for a specialty, if you really feel like oral surgery is something that really interests you, or orthodontics is something that interests you, we take those into consideration when trying to help place you. We do have our students have a hands-on experience with trying to place themselves into externship with career services and your team of faculty to support you and back you up and guide you along the way as well.
It's so exciting that you get to get into the industry before the end of the program.
It is. I love it. It's great. And, for the most part, our students always are able to extern somewhere that they really want to, or they love, or, somewhere like, hey, I saw this place is hiring, and they're willing to take me for my externship, and they kind of already, fingers crossed, have a job lined up. So it's always really exciting to see things like that.
And just so that we also, that same career placement or the same career services specialist who helps you find your externship and places you in there will also provide career placement assistance to all of our graduates. So they're going to do everything they can to help you find a job in the industry. And our most current placement rate, we don't have 2021 numbers yet, but the 2020 placement rate for our dental assisting students is at 93%. So our career services folks do a really nice job. They're very diligent.
That's a great number. I don't know if I was aware of that number from 2020. It's fantastic.
Yeah. And in the pandemic, 2020. So
yep. And that was knee deep in the pandemic. So yeah, that is fantastic.
Yeah. All right. Do you see any other questions? I don't see
I do not have any other questions. I will leave everybody with my contact info as well. If you have any further programmatic questions, if you want to reach out to me, I just put it in the chat there. It's very easy. It's lisa.brown@yti.edu. Please feel free to reach out to me with any follow-up questions about the program. Obviously, any admissions questions, things like that, you can direct to Julia, but I am happy to answer any of your questions. We are starting Module 3 on March 21st, which is 2 weeks from today, which is very exciting. So we'll be starting admin and career development and lab procedures in 2 weeks. So I hope to see you all there. I hope to see everyone on my roster soon. I'm really excited.
Yeah, me too. Well, thank you so much, Lisa. So hopefully you've had time to take down from the chat what you need to take down. And you can always call the school. You can call the front desk. They'll get you to where you need to go as well. And just know that we are all here and happy to help. All right.
Thank you, Julia. Everybody have a great afternoon. Thank you for joining us.
Thank you. Bye-bye.